Hello, my name is Todd Williams and I'm a dermatologist at Ashburn Dermatology and Skin Surgery Center. I want to take a few moments of your time to talk with you about something I think is important, and that is the drug Accutane. As it turns out, Accutane was the original trademark drug. It is now better known as isotretinoin, and there are multiple generics of this drug. I've been prescribing this drug for at least 20 years and have written this drug for at least 5,000 patients. So I wanted to talk about its benefits, its indications, and also clarify some issues that may surround it that possibly could be hyperbole or at least overly brought into the media or in the public in terms of concern. We use Accutane considerably for cystic acne, very bad scarring acne. We also use it quite often for acne that's resilient to other sorts of treatments. The great thing about Accutane is that it works unbelievably well. You take the medication, which is a pill, once a day for about 6 months. And the majority of patients are actually cured for life with the course of Accutane. Not every patient, but the majority are. Sometimes you have to treat with more than one course. Side effects are very uncommon except for a few predictable things like lip chapping. Some patients do get some dry skin, some itchy areas. Some people are a little more sun sensitive. Some people get a few sore joints at first. Rarely, patients get headaches that can become a problem when we have to adjust their dosages. And some patients get mood swings, some mental health issues temporarily like depression. And for those patients, we have to adjust their dosages. Very few people actually have to stop the drug ever from side effects. The biggest thing about Accutane that gets also a lot of appropriate attention is that if a woman gets pregnant while taking the drug, the baby usually has a birth defect, and that's serious business to all prescribers and to the FDA. So there are steps that we take to make sure we are prescribing this drug to the right female patients and we are protecting any pregnancies from occurring. And there's a program called the iPledge protocol, or the iPledge program, that we use to make that more seamless for the patient. It's my favorite drug to prescribe because I can always tell the patient that they're going to clear, and one way or the other, perhaps a longer course than usual or just enough dosage, we can get people virtually always clear by using Accutane. So if you have concerns about this drug, I can alleviate those easily with my experience of having seen thousands of people do very, very well. Of course, the internet is notorious for anomalies, stories that are unusual of suicides and acting out and homicidal ideation and just all sorts of liver toxicity and just a lot of things like that, which we virtually never see anything of that nature, and most of that is overblown. So if you have significant acne that hasn't responded well to standard therapy, or if you have cystic or scarring acne, I strongly encourage you to consider Accutane. You can see your healthcare provider for that. If you live near Ashburn, North Carolina, we'd be happy to see you at our practice. But no matter where you live, there are providers in the area that could help you use this very sensational medication for your acne. So thanks for listening, and appreciate it.